Welcome everyone. It is a privilege to address all you beautiful moms on a topic that is important to your health as well as your baby's health. Thank you to Curaprox for sponsoring this talk. Dental health for moms and babies. I am Naseema and I have been an oral hygienist for the past 15 years. I'm currently working at a dental practice in Rondebosch, Cape Town, and this practice has a special interest in pediatrics. I'm also a mom of two, and therefore I can relate to how overwhelming this period can be for a new mom. Pregnancy is definitely an exhilarating time, filled with lots of excitement and preparation for your new baby. Taking care of your teeth while being pregnant can often be the last thing on your mind, and most women have no idea on how important it actually is. But hopefully the information provided in this session will increase your awareness of how important it is for your teeth and mouth to be healthy during pregnancy. Let's get started. Let's start with some important facts. Dental health for the baby starts in the mother's womb. Good nutrition from the mother during pregnancy is important in the development of teeth and overall health of the unborn baby. Dental health is key to a healthy pregnancy. Dental health is important for looking and feeling good. It is also linked to overall health. Let's have a look at oral health problems during pregnancy. A significant number of women enter pregnancy with oral disease. During pregnancy, hormonal changes occurring in the body is completely normal. These pregnancy hormones can make some women at risk of developing gum problems. These include gingivitis, which is the inflammation of the gums. It is also likely to occur in the second trimester. Some women may experience pregnancy tumors that appear on the gums. Most types of gum problems are caused by pregnancy hormones, therefore they tend to resolve after birth. But a small number of women may develop ongoing gum disease that will need treatment after pregnancy. There may be changes to the saliva flow, such as an increase in saliva flow, or some may even experience dry mouth from a decreased saliva flow. In some cases, some women may experience infection of the supporting structure of the tooth, which is caused by periodontal disease. Untreated gingivitis can lead to periodontal disease and even result in tooth loss. Tooth decay or dental caries can increase during pregnancy. This is not because the baby is taking your calcium or weakening your teeth. Changes in the dietary habits, frequent acid changes, and hormonal changes may add to the risk of developing tooth decay during pregnancy. Experiencing nausea while being pregnant can increase an intake of over-the-counter medications that help neutralize stomach acids, and these medications contain sugar. This adds to the risk of developing tooth decay. Vomiting can produce erosion of teeth, cause irritation of the gums, and even weaken tooth enamel. Dietary changes during pregnancy, such as odd cravings, may lead to an increased consumption of foods with carbohydrates and sugars, adding to the risk of developing dental decay. Some research suggests that the bacteria that causes inflammation in the gums can actually get into the bloodstream and target the fetus, potentially leading to premature labor, low birth weight babies, and even preeclampsia, which is characterized by high blood pressure and can be dangerous for the unborn baby. Signs of gum disease during pregnancy. Some women experience swollen, tender, or bleeding gums during pregnancy. Bleeding gums are caused by a buildup of plaque on the teeth. These signs listed, such as sensitivity, pain on chewing, and pus around a tooth, should not be ignored during pregnancy, as it can become a more serious problem. With the information that you have heard thus far, take a moment and think. Do you have any dental health issues currently? Do you only visit the dental practice when you have pain? Is regular 6-monthly checkups part of your routine? Dental visits are safe during pregnancy. It's an old wives' tale that going to the dentist while pregnant is risky for developing baby and mom-to-be. In fact, just the opposite is true. Good dental hygiene is part of a healthy lifestyle for everyone. Treatment during every trimester is safe. However, the second trimester is the safest and most comfortable, especially for those moms who experienced morning sickness in the first trimester. The third trimester is safe as well, but you might find it a bit hard laying on your back for an extended time, as at this point the baby is a lot bigger. Always tell your dentist or hygienist if you are pregnant. They will take extra precautions when they know that you are pregnant to ensure that your treatment is safe for you and your baby. Prenatal steps to a healthy mouth. Good oral hygiene is especially important during pregnancy. If you already have good oral hygiene habits, you don't need to do anything special when you are pregnant, other than be more aware of any changes happening in your mouth, such as bleeding gums or toothache. Following these steps can help you have a healthy mouth during pregnancy. Brush at least twice a day for 2 minutes with a soft, medium-headed toothbrush with fluoride toothpaste. An electric toothbrush is a good alternative. You may be tempted to brush your teeth immediately after vomiting, but wait for at least 1 hour. Brushing your teeth immediately after vomiting can cause damage to the teeth by stripping away the enamel. Floss daily between the teeth to remove food particles caught between them. You may also want to use a mouthwash, but make sure that it's alcohol-free. It's the frequency of snacking that is the issue, rather than how much food or drink you consume. Try to limit sweet snacks to one setting and choose snacks carefully. Follow a healthy diet with lots of fresh fruits and stay hydrated with water, which will also help to keep the pH of the mouth in neutral. Lastly, have your dental checkup. This is important for your overall pregnancy care. At least one visit during your pregnancy is all you need. Many women do not visit a dental practice during pregnancy. Major reasons for this is that women do not feel that it is important, and some cannot afford to visit a dental practice. You are more likely to see your doctor or nurse during your pregnancy, and they can provide you with referrals to a suitable dental practice. If you have any problems happening in your mouth while being pregnant, please don't delay visiting the dentist until you have your baby. The moment you've been waiting for has arrived. The focus thus far was only on your health and how to maintain good dental health. Now I'll discuss how to care for your baby's mouth. Welcome to the Mommy Guilt slide. No matter what you decide, others will surely have an opinion. Only one thing really matters, and that is which choice is right for you and your baby. Often you will hear the phrase, breast is best, but very quickly you will learn that a fed baby is a happy baby. The benefits of breast milk is endless, as it contains the proper nutrients that your baby needs, which includes protein, carbohydrates, fat, and calcium. It contains natural antibiotics that help your baby resist illnesses such as ear infection. It's usually more easily digested than formula, so breastfed babies are often less constipated. If there is a good supply of milk, it's available whenever the baby wants to feed, and it doesn't cost you a penny. Breastfeeding isn't always an easy experience. As a first-time mom, lots of moms find these new experiences can be very overwhelming. There are amazing ladies out there that can help you and support you in order to make your journey a lot easier. A lactation consultant is a health professional who specializes in breastfeeding. Typically, women reach out to these lactation consultants for help with painful nipples, milk supply, and making sure the baby is feeding correctly. Breastfeeding your baby doesn't have to be hard. These consultants are a great source of physical and emotional support. Having help on hand can let you fully enjoy the breastfeeding experience and focus more on building that precious bond with your baby. Formula. Formula is the best possible alternative to breast milk. It's convenient as the baby can be fed by anyone and at any time. Your partner can help out with nighttime feeds and share that bonding experience. Scheduling feeds may be easier. Formula isn't digested as quickly as breast milk, so formula-fed babies don't get hungry as often, especially in the first few months. The temperature of the milk is very important and should be tested before giving it to the baby. This can be done by putting a few drops on your wrist or the back of your hand. Formula has to be bought and therefore is an expense. But remember, what works for your baby doesn't necessarily work for others. Breastfeeding should never be painful, making you just want to push through for your baby's benefit. There might be reasons as to why breastfeeding is painful. A common reason for this can be a tongue tie or a lip tie, or in some cases both. These restrictions for the baby's tongue or lip makes it difficult for feeding for both mom and baby. If you think your baby has any of these restrictions, ask a lactation consultant to check, or a pediatrician, or even a pediatric dentist. Cranial sacral therapy helps calm and soothe the baby. It helps the circulation and flow of the cerebral spinal fluid by removing any blockages and stimulates the nerves. Increased spinal fluid circulation can help regulate and normalize a baby's central nervous system. This enhances their ability to heal and speeds up the recovery of various types of head injuries associated with a traumatic childbirth. Chiropractic care is safe for newborns within the first few weeks after birth. They can help treat issues such as acid reflux, colic, underdeveloped digestive systems, misaligned spine, and even pain or infection. Some important facts about bottles. Give your baby only breast milk or formula in a bottle. Watch your baby's cues that he or she is full. Then remove the bottle even if it's not empty. Never leave the baby with the bottle in their mouth. Filling the bottle with anything but milk is not a good idea and can start a really bad habit. Once the child is introduced to, for example, juice in their bottle, they can even reject the milk. Because the juice tastes a lot better than the milk, as it's filled with lots of sugar. When your baby is around 6 months old, you can help your baby start learning to drink from a cup. It's the best to stop using bottles by the time your baby is 12 months old. With so many baby bottles and cups on the market, how do you know which is best for your baby? Ideally, we want babies to develop proper oral habits and tongue movements, which will help them develop full and healthy jaws. What we don't want is bottles with long, hard spouts or long straws. These impedes the tongue movements. Rather, we want a shorter straw as it goes to the top of the tongue, guiding the tongue to touch behind the front teeth when swallowing. It encourages proper lip and facial muscle development necessary for nasal breathing and proper oral posture. Using a pacifier. Pacifiers are commonly known as dummies. A pacifier can help your baby stay relaxed, sleep better, and feel less anxiety when the mother is away, for example, a working mom. Prolonged use can interfere with the development of the mouth, jaw, and teeth unless a proper designed pacifier is used. Pacifiers are developed in different sizes depending on the weight of the baby or child to make sure that the correct size is used. Never dip a pacifier in anything sweet before placing it into the baby's mouth, for example, honey. Things to look out for when purchasing a pacifier: a soft silicone to imitate the natural feel of a nipple, a flat tip that works well with the palate and prevents an open bite, a rounded shape that prevents misalignment of teeth, a breathable design that promotes proper breathing through the nose and not the mouth. Nasal breathing is best for optimal cranial growth and development. We are designed to breathe through our nose, and the nose acts as a filter to prevent small particles in the air from getting into our lungs. If you notice your child sleeping with their mouth open, gently push their chin up so that the lips touch and hold for a moment to allow the lips to seal. This will encourage nasal breathing, and it's very important during infancy. You can start caring for your baby's gums right away. At first, the care won't involve a toothbrush and toothpaste. Instead, use these simple guidelines to clean your baby's mouth. Get a soft, wet washcloth or a piece of gauze. Remember, this washcloth must only be used for the baby's mouth. Gently wipe down your baby's gums at least twice a day. Especially wipe down your baby's gums after feeds and before bedtime. This will help wash off bacteria and prevent them from clinging to the gums. Bacteria can leave behind a sticky plaque that damages infant teeth as they erupt. The picture in the slide is a silicone finger toothbrush, which can also be used to care for your baby's gums. Babies generally begin teething anywhere between the ages of 4 months and 6 months. This puts pressure on the baby's gums, causing them discomfort. You will begin to notice some signs that the teething process has begun. Some common teething symptoms include excessive drooling, chewing on anything, gum rubbing, irritability, and even a slight fever. Cutting teeth can be a long and difficult process, but there are several things that you can do to alleviate your baby's teething discomfort. Most babies will chew on anything and everything to ease their aching gums. Keep plenty of soft cloth toys and rubber teethers handy to control the munching tendency. By gently wiping your baby's face with a damp cloth, you will be removing any excessive saliva that can irritate their skin. Cold items will also help to reduce the need to chewing on anything. Offer your baby cold teething rings or even a mesh teether where you can place some fruit inside of them. By massaging the gums, you will soothe your baby's pain. You can also offer them a pacifier to soothe during irritability. Contact your pediatrician if teething is accompanied by prolonged spikes in temperature, diarrhea, and any other severe symptoms. There are also pain relief gels available. Ask your pediatrician or your clinic nurse what would be good for you to use for your baby. Eruption stages of baby teeth. Baby teeth start erupting around 6 months of age and continue all the way until the child is 2 to 3 years old. There are typically 20 baby teeth, 10 on the top arch and 10 on the lower arch. Each tooth has a different name and they all have different eruption dates. The importance of baby teeth. Babies need healthy teeth to eat, eventually talk, and have a beautiful smile. Baby teeth are just as important as permanent teeth, even though they fall out. Baby teeth acts as a guide for the permanent teeth when the teeth are ready to erupt. How to care for milk teeth. Having a good brushing routine is important. Brushing the baby teeth twice a day, morning and evening, using a circular technique which covers the entire tooth surface. Brushing together is important. You can brush your teeth and they can brush theirs on their own, and then to finish up, you can do a final brush of your child's teeth. Try and make it as fun as possible. Don't let your child ever use your toothbrush. A toothbrush should be replaced every 3 months. In the beginning, brushing with plain water is absolutely fine, and slowly you can start using toothpaste. Toothpaste recommended for a young child should contain fluoride, which is important for the development of strong and healthy teeth. A rice-sized amount of toothpaste is usually enough. Supervised brushing is important to make sure that they reach all teeth. Supervised brushing should continue until 9 years, and many will say, why wait until 9 years old? But in actual fact, this can be a difficult time for children to keep their mouth clean. They can have loose teeth and new teeth erupting, making them not wanting to brush. With your help, it can make the process a lot easier. Tooth decay in childhood. Tooth decay is the most common chronic childhood disease. Tooth decay occurs in toddlers when bacteria within the mouth begin to weaken the baby teeth as a result of inadequate dental care or high sugar diet. Another common cause of tooth decay is going to bed with a bottle. This particular condition is known as baby bottle decay or caries and is a common problem amongst children under the age of 5, and this can be prevented. Baby bottle tooth decay usually occurs on the front teeth as a result of contact with too much sugar from a bottle. Bacteria in the mouth feed on the sugar, multiply, and produce acid as a result of a waste product. This acid attacks the teeth and tooth enamel, resulting in tooth decay. Bacteria that cause cavities can be passed on from one mouth to another by sharing spoons or even kissing your child on their lips. This is why it is important for the entire family to have good dental care in order to prevent these bacteria from moving from one mouth to another, or by not placing spoons or pacifiers into your mouth and then into your child's mouth. Let's have a look at how we can prevent baby bottle tooth decay. Firstly, never put the baby or child to sleep with a bottle of juice or milk. The sugar in the liquid will remain on the baby's teeth for hours. These habits should not be started as they are very difficult to stop or change. Never let your child walk around with a bottle of juice or milk dangling from the mouth. Try and avoid filling the bottle with sugary water, fizzy drinks, or juice. Teach your child to drink from a cup from around 6 months of age. Encourage healthy eating habits and limit sweets in general. Brushing twice a day to remove any plaque or bacteria. And regular dental visits are important to detect early signs of tooth decay in children. Because baby bottle tooth decay affects the front teeth of the baby, it is important to lift the baby's lip once a month to have a good look at those front teeth. If you see any white spots, these can be the start of cavities. It is then best to take your baby to a pediatric dentist or any dental office so that they can have a better look and reassure you as to what can be done about these cavities starting. Now you might be wondering when to schedule my baby's first dental visit. Your child's first dental visit should take place after the first tooth appears, but no later than their first birthday. You might wonder, but why so early? Well, remember, as soon as your baby have teeth, they can develop cavities, and it's best to have the teeth checked by a dentist or an oral hygienist. In this way, you will know if there are any signs of early tooth decay. To get your child ready for this visit, talk to them about what's going to happen and be positive. Reading stories or watching videos about first dental visits may help them being less fearful and more excited. At this visit, your child's mouth will be examined to make sure that their jaw and teeth are developing in the way that it should be. Think of this appointment as a happy and fun experience. If your child becomes upset or scared during this visit, work with your dental professional to help calm your child. It should not be a forced appointment and can be rescheduled if the child does not calm down. Remember, we all are on the same team. Oral hygiene education on how to care for your child will be provided at this visit. Products that suit your child and their mouth can be recommended. And of course, any questions or concerns that you have can be answered for you at this visit. In conclusion, these are some key facts to remember. It is evident that oral health care is important for pregnant moms. Remember, it is completely safe to visit your dental practice while being pregnant. Start cleaning your baby's mouth before the teeth appear. Milk teeth are just as important as permanent teeth, and your baby's first dental visit should take place by their first birthday. Mothers are the most important influence on their child's general and oral health. You are the key to a lifetime of good oral health for your child. When your mouth is healthy, your baby is more likely to have a healthy mouth too. I sincerely hope that after listening to this talk, it has increased your knowledge on how to care for your teeth as well as your baby's teeth and mouth. If you have any questions or would like to reach out, my email address is on the slide, dental.myotherapist@gmail.com. It's a privilege to convey this information to you. I thank you all for listening.